Ready?
Hey guys, I'm Michael Allen for TravelCostaRicaNow.com, and we're going to be talking to Karen. And I want to be up front right from the very beginning. This is a testimonial about our mutual friend and someone who helped you out a lot, Johnny. Now, if you don't know who Johnny is, Johnny's our guy for anything medical or dental. So if you need liposuction or stem cell therapies or breast augmentation or whatever the heck you want, in your case, hip replacement, Johnny's your guy. And just so we can get this done now, if you go to our website and you're interested in talking to Johnny because you're thinking about maybe possibly coming to Costa Rica and having something done medically or dental wise, you can go to our website, scroll down, and you can fill out a quick form, and Johnny, we'll get it to Johnny and he'll get back with you. So I just wanted to say that first. Karen, thank you so much for talking to us. I didn't know you lived here. You've been here 6 months, right?
Almost to the day.
Really?
August 1st was my first day here.
So how did you pick Costa Rica? Was it a long process? Did you spin the globe and go like that and go, yeah, Costa Rica? Or
I started looking into different places to retire because I wanted to be done working at 62, and you really can't afford insurance in the United States. So I came to where I knew I could afford if I needed a procedure.
had you been here before?
I had. I went to Costa with my friend and fell in love with the country basically when I walked off the plane.
So did you keep coming, or you just had in the back of your head that Costa Rica would be a good place to come to?
I knew it's what I was going to do as soon as I retired.
Now, just some inside info. We started talking before we started taping this. Come to find out, we're like brother and sister. We're both from Columbus, Ohio. Kind of grew up there. She worked at the Columbus Dispatch, which is a big newspaper in Columbus, Ohio, and I used to deliver the Columbus Dispatch living in Reynoldsburg. So
Small world.
small world stuff.
Very small world.
Right. Okay. So let's get into kind of you didn't move here though to get hip replacement.
No, I moved here to retire and have an adventure.
Right. So was the hip bothering you prior?
Yes.
Oh, you actually did say you've had a couple of surgeries, right?
I've had 12 surgeries at least.
Oh my God! You're not going to show us all of them, are you?
I can name them from
Name
head
them.
to toe.
Let's hear a couple.
Both eyes, both wrists, both elbows, both hips, one knee, back, foot.
So you're like bionic now.
I even had a breast reduction.
You're like a bionic woman.
As a matter of fact, I kind of call myself a bionic bitch.
You can say that on our
Okay.
channel. You can say that.
I call myself the bionic bitch.
We won't call you that, but you can obviously call
But I
yourself
am.
that.
And
So-
I'm proud of it.
So anyway, let's kind of give Johnny some props. You got a hold of Johnny. How did he help you out?
Okay, when I talk to him, he says I'm like a patient advocate. What I do is I find the best match, wherever that is, for what you need, and the best doctor for the best value. And I will say that he is quick and proficient. And I had the surgery. Well, we did an MRI first because he's like, how do you know you need surgery? And I'm like, well, I've had a few, and I kind of know my own body.
And it was a hip replacement, so obviously your hip was,
I couldn't walk.
yeah, so you kind of knew.
Well, I know my own body, and I
Yeah.
told him because, you know, the doctor didn't want to believe me, so I had to have the MRI and the x-rays done and all that, and I'm like, okay. And then he looked at the x-ray or the MRI and he said, how is she walking?
Right?
Yeah, so I know my own body. I've had it for a few years.
You know, that is true. I just want to, again, give another shout out to Johnny because this is what he is good. I've made other videos about him, but he's vetted a lot of doctors. He knows the good, the bad, who not to send to, who's going to back their,
If you've done any kind of drugs or alcohol or anything like that, he will not use you.
Right.
So, I mean, he really vets them to the nth degree, and I appreciate that because I have questions.
So Johnny hooked you up with the doctor where was that doctor? We can give him a shout out too. Where was that doctor?
That he was at the CIMA hospital in
San Jose.
No, not San Jose, in San Carlos. There's like a little private hospital,
Oh.
CIMA.
kind of a, okay, got it.
That's
Yeah,
why I'm here in this town, because it's just a stone's throw from San Carlos.
So you go to the doctor and you know, he's saying, well, we got to make sure, as you say, so that's where the MRI comes in and that.
The MRI had already been done, and he says, I don't understand how you're looking, and by goodness, they got me in that Saturday.
Really?
Have you ever had surgery on a Saturday?
No.
Not in my life did I ever think I was going to have surgery on a Saturday. Fixed me right up. And the best part was, I don't know if this guy is a miracle worker, because I literally had the surgery, got up out of bed, walked to the bathroom.
So I know you said it was quick, but
Same day.
So let's just, we're going to get back to that because that's very interesting. But so from when you started, you know, you meet the doctor. Johnny sets you up with the doctor. From when you meet the doctor to your surgery, how long was that? I don't even know if I actually met him before I had the surgery. Oh, so you had to do all the preliminary stuff. And
It was very quick. It was all within like 5 days. Once he saw the MRI and said, how is she walking? I was in surgery.
So I kind of missed it. So let's say that again. So you got the surgery and you were walking what? The next?
The minute.
Is that even?
They call me a miracle.
That's almost like the.
I've not even had a pain.
Do you remember
pill.
Ernest Angley? Heal!
Yeah.
I can walk.
I've never had a pain pill.
That's crazy.
I know. I did my own therapy. The therapist said she's never seen anything like me.
I swear we're not making this up.
I'm not making this up because I was totally floored. I went home. I live in Atenas, and I live on this mountain, and I was looking out across the city because I have a heck of a view. And I just was having a conversation with God, and I said, thank you for blessing me as much as you've blessed me. And a fifth of a rainbow showed up in the sky.
And you were ready to go for a jog.
I still have chills every time
Look at
I bring
that,
it up.
you do. Oh my gosh.
Every time I bring it up, I feel like I'm living on, I'm knocking on heaven's door where I'm at.
Wow.
And I really think my sweet Babu was there putting his hand on the surgeon.
Your husband, right? You see, so her husband passed away.
A year before I came.
Yeah, sorry, obviously. Condolences
okay.
for that.
It happens.
But life, like you said
Life.
earlier before we started, so I don't sound bad, but life goes on and you gotta...
You either get busy living or you get busy dying. I know,
That's
he
what
just
that
told me about that.
I was showing them.
That was so funny that he has that on his neck, because I'm like, that's what I thought immediately, because my friends were like, how can you at 62 pick yourself up and go by yourself to another country? Well, I'm brave.
And
It's not that hard, is it?
Really wasn't.
Yeah.
Sold everything, got on a plane. My friends came with me, helped me, because I have 3 puppies that I'm not going anywhere without.
I saw very cute, by the way, especially Bling Bling.
She came home in my pocket.
I love that name, Bling Bling. Okay, so I don't know if we can ask you, and you can tell me, Mike, you're getting a little personal, but can we go over how, did you use insurance? Did you pay cash?
There is no insurance in a pre-existing condition in this country.
So
my hip hurt when I got on the plane. I had to be wheelchaired.
So this is cash.
It was cash, and it was very reasonable.
Yeah, we don't have to say what it was. But
no, because it's different for everybody. It depends on your age and how much you have to go through. For me, I still think it was way more reasonable. I know in the States I had my other hip done, and even with insurance, it was a costly affair.
Right. So I guess the question always comes down to, if you were happy with the price, then you're happy with the price, and you're saying it's reasonable, so we're going to go with it's reasonable.
And I do believe Johnny will work with you if you have to make payments or something like that. I happen to be lucky that I invested well at a very young age, and I hope I don't have to spend it all on surgeries, but you know.
Are we good now? Is there other things there might be an issue with? You sound like you're pretty bionic now.
I actually have a herniated disc between C3 and C4.
Oh, that's right. You said you...
Yeah, I was supposed to have surgery yesterday, but the equipment, the robotic arm failed, or there was some... He didn't tell me.
Some issue.
But the doctor did not feel that he should continue. He wanted to wait till the equipment was pristine. So I'm going Saturday to San Jose or Santa Ana and have the surgery.
Yeah, we're also together, and I've had back issues for a long time too, and those kind of suck, actually.
Well, I did pretty well on my first back surgery, which was L something, way lower, and that was a 45-minute surgery, and again, I was mowing grass in 2 weeks. I'm pretty good at healing.
I guess so. Maybe I should be having back surgery.
I'm only telling you, it's me.
I've done it the old-fashioned way. I'm on the couch and then I gradually get up with the cane. I have him help me out.
Yeah, no.
It was terrible.
My previous surgeries were kind of like that, but this one, no. I got up out of bed, went to potty.
So how are you liking Costa Rica?
Love it. Love it. I feel so good. I've lost 50 pounds in 6 months.
Congratulations.
Got off all my meds. I'm no longer diabetic. My cholesterol total was 171.
How great is that?
Oh my goodness. It is so great to not be sick anymore.
Karen, we need to do more videos with you because you just exude this positivity about life, man.
I've always been told that. I've always called myself Positive Patty.
I thought you called yourself something else.
Well, that too, but I have been told everywhere I work, it's like, you are the most sickening person ever.
Too positive.
Too positive.
Always looking at the bright side.
One of my bosses called me, I'm a cheerleader, but I'm like a cancer he wished everyone would catch.
Nice.
Because I was too happy.
That's funny. That's good.
I worked for the state. You know, you're not supposed to be happy working for the state.
Well, I guess it's how you approach it, right? And obviously you approach it with a...
I approach everything with total exuberance.
So you plan on staying here?
Yes, I do.
All right, cool. So we should be running into you again. So
I want to move all around the country so I can see everything.
Well, you're in a pretty nice spot. Atenas is a pretty sweet spot.
It is beautiful, and I have a big 3-bedroom house.
And the climate's pretty nice, obviously.
No air conditioning, no heat.
See, that's good. Here,
all year long.
Here in Fortuna, it gets a little humid.
No humidity there. Not even seen a mosquito.
Well, I just want to thank Karen because she wanted to do this, actually, let's be honest, to help Johnny out and give a testimonial to the help that Johnny gave you.
Johnny is the best.
And we want to do that too because I felt like you do. When we met him, seriously, he's hard to find. He is hard
Very
to
genuine.
find. Somebody trying to help you.
Can I tell you a little story?
Yeah.
On my first trip to not actually meet the doctor, but when I went to have my surgery, he picked me up that first time. And he stopped at this restaurant and I ordered something and he ordered a pizza. Well, he ate half the pizza. They have these guys that stand outside in these yellow jackets. They direct traffic and have you park, even though they don't actually have a job there. So he made sure that they knew that pizza was left for them.
That probably
guy.
is a perfect representation of him. We don't want to sound too effusive, but
no, it
is
really
kind of true. So
he's on top of everything. He's
quick.
He's quick, but in constant contact with you to make sure that you know every step of the way how it's going to be. And he soothes you. He never leaves you at the hospital. He's right there. He takes care of you. He watches your stuff, everything.
I wish you could have seen that. If you have a time, it's worth seeing because it was a really weird thing that happened. Somebody basically wrote us and said, help. My dad is stuck down here. He's in the hospital. It's this crazy story. So I read it and I go, and it was medical. I was like, well, maybe Johnny can. So I didn't even answer the person. I just forwarded it to Johnny. So he just happened to see it as soon as I forwarded it to him, got on it. It's unbelievable. We made 2 videos about this guy. What was his name? Ted? He was a military guy. Johnny went out of it's a great video. And we just made it about, I don't know, maybe a month and a half ago this happened. But it just shows you, he literally did, sight unseen, started helping them, got the dad, he needed surgery. They were letting him, I don't want to say rot in the hospital, but that's kind of what they were doing. And there was a problem with the military insurance and all this. He's talking talking to people in the United States, going way out of his way. I mean, way out of his way.
That's the Johnny.
It was so good, we had to make a video about it. So I got to meet the guy. We did a little interview with him. It was very
Johnny's
interesting.
amazing. He goes to bat.
I agree.
100%. He could be working on 7 people at the same time. You would never know it.
All right, Karen. Well, thank you so much for talking to us. And we went, I know this is sounding like we're just trying to push Johnny, but, well, we kind of are, I guess.
But you just don't understand
I know,
until
right?
you go through it. I'm not making
You're going to
this
think
up.
I paid you, Karen.
Well, yeah, he didn't even buy me a piece of chocolate next door. Had to go buy my own.
All right, Karen, thanks so much. Hey guys, if you want to talk, if you're thinking about Costa Rica's on your map or any kind of medical stuff, like I said before, or dental, please go to our website, scroll down, you can fill out a very quick questionnaire and I can shoot that over to Johnny. Anyway, guys, I'm Michael Allen, travelcostaricanow.com. Peace, guys. Hope it helps. Things are going to pop up. If you're thinking about living or traveling anywhere, man, do your homework and research, and there's no better place to start than with Karen's video. Ciao.